evening to all. Welcome to the 191st day of the Swasthya 365 days project. Today's topic is hemophilia. Hemophilia is usually an inherited bleeding disorder in which blood does not clot properly. This can lead to spontaneous bleeding as well as bleeding following injuries or surgery. Blood contains many proteins called as clotting factors that can help to stop bleeding. People with hemophilia have low levels of either factor 8 or factor 9. The severity of hemophilia of the person is determined by the amount of factor lower in the blood. The lower the amount of factor, the more likely it is bleeding will occur, which can lead to serious health problems. In rare cases, a person can develop hemophilia later in life. Majority of cases involve middle-aged or elderly people or young women who have recently given birth or rare in later stages of pregnancy. This condition often resolves with appropriate treatment. Causes. Hemophilia is caused with a mutation or change in one of the genes that provides instruction for making clotting factors, proteins needed to form a blood clot. This change or mutation can prevent the clotting protein from working properly or to be missing altogether. These genes are located on the X chromosome. Males have one X and one Y chromosome called as XY chromosomes, and females have two X chromosomes, XX chromosomes. Males inherit X chromosome from their mothers and Y chromosome from their fathers. Females inherit one X chromosome. The X chromosome contains many genes that is not present in that of the Y chromosome. This means that males have only one copy of the most of the genes of the X chromosome, whereas females have two copies. Thus, males can have a disease like hemophilia if they inherit an affected X chromosome that has a mutation in either factor 8 or factor 9 respectively. Females can also have hemophilia, but this much is rarer. In such cases, both X chromosomes are affected and one is affected and other one is missing or inactive. In these females, bleeding symptoms may be similar to males that have hemophilia. The female with one affected X chromosome is a carrier for hemophilia. Sometimes a female who is a carrier can have many symptoms of hemophilia. In addition, she can pass affected X chromosome with clotting gene mutation onto her children and learn more about the inheritance pattern of the hemophilia. Even though hemophilia runs in the families, some families have no prior history of family members with hemophilia. Sometimes these are carrier females in their family but not affected boys just by chance. However, about 1/3 of the time, the baby hemophilia is the first one in the family who is affected with a mutation in the gene for clotting factor. Hemophilia results in bleeding within joints that lead to chronic joint disease and pain. Bleeding in head and sometimes in the brain, which can cause long-term problems such as seizures and paralysis. Death can occur if the bleeding cannot be stopped for it occurs in a vital organ such as brain. Types. There are several types of hemophilia. The following two are the most common: hemophilia A and hemophilia B. Hemophilia A is called as classic hemophilia. Hemophilia B is called Christmas hemophilia. Hemophilia A is a type caused by lack of decrease in clotting factor 8, whereas the hemophilia B1 is caused by lack of clotting factor 9. Thank you.